And dear students, I am Dr. Jamil Abbas, and this lecture is concerned with the skin and body temperature. Here are some of the clinical or the pathological changes which are or the diseases which are involved with the skin body temperature. First of all, there are some minor heat illnesses, and these are usually or commonly seen in your practice as the heat edema, heat syncope, heat cramps, prickly heat. And I will explain here one by one what is meant by the heat edema. Actually, this is the edema, usually the ankle edema, which occurs at ankles, and this is due to the vasodilatation of the cutaneous vessels. And due to heat stress, actually the aldosterone is increased, and there may be the sodium retention. And due to the higher hydrostatic pressure, the blood is going to accumulate in your peripheral vessels, and due to the gravity the edema appears uh, at the ankles. Basic cause is the vasodilatation due to the heat. Then the heat syncope, that the patient becomes faint in the heat environment, and this is again due to the severe vasodilatation when the blood is pooled in the peripheral area, particularly at the ankles. Whenever you are going to have a prolonged period of the sitting, after that you're going to have a standing posture, immediately blood is going to cool down, which is in your dilated vessels, the ankles, and the patient may become faint. This is the heat syncope. Then there are different types of heat cramps, and actually this is muscle pain. This is due to the sodium depletion. When there is excessive sweating, there is a depletion of the your sodium in your body, and this leads to the problem in the muscle contraction, and these muscle contractions become painful, and these are known as heat cramps. Then we'll move to the prickly heat. This is simply very when the sweat is going to accumulate under the skin, then the blister type of the thing, your rashes are appearing in your over the skin. Whenever the sweat is not able to move out of the body, that this will lead to the prickly heat, simply which is known as garmi dane. That is the prickly heat. Then we move to the major illnesses which are concerned with your skin body temperature. These are mainly the heat exhaustion and the heat stroke. Heat stroke is further divided into the classical heat stroke and the exertional heat stroke. These are two different things. Heat exhaustion, just wait a minute. Heat exhaustion basically is concerned due to the two reasons. Whenever there is a water depletion or volume depletion, or whenever there is a sodium depletion, both of them can lead to the heat exhaustion. That means, wait a minute, I can. These are all the slides which are concerned with the heat syncope, which I have told you earlier, and their management. We are not concerned with in details of all these things. And this is here is your concern with the prickly heat with different names for the prickly heat, the lichen tropicus, heat rash, and the miliaria rubra. These are all the different names of these your prickly heat. Then we move to the major thing, which is your hyperthermia, and this is hyperthermia is two types of hyperthermia, maybe the heat exhaustion and maybe the heat stroke. What is meant by the hyperthermia? First, the elevation of the body temperature above the normal diurnal range, that 36 degrees centigrade to 37.5 degrees centigrade, due to the failure of the thermoregulation. Now, this is the hyperthermia, and then keep in mind that the hyperthermia is not as synonymous with the more commonly sign of the fever. Fever is actually induced due to the cytokine activation, and this is due to during the inflammation and regulation of the, and this is due to and regulated at the level of the hypothalamus. Basically, hyperthermia is not the fever. Hyperthermia, the fever is due to your cytokines and due to the inflammation, and this fever is regulated at the level of the hypothalamus. While whenever their core body temperature rises above the diurnal range, that is known as the hyperthermia. Then this hyperthermia, most common cause severe hyperthermia, that is which is above 40 degree or 104 Fahrenheit, caused by the failure of thermoregulations, are again back to the same thing, the heat exhaustion, the heat stroke. The heat stroke may lead to the neuroleptic, that means with the seizure fits, malignant syndrome, and the malignant hyperthermia that may lead to the death. Now, what is meant by the heat exhaustion? There are two different things, heat exhaustion and heat stroke. Keep in mind that heat stroke is mainly concerned with the neurological symptoms, while the heat exhaustion is simply due to the depletion of either the water or the sodium salt. Now, this is where the pathophysiology of the hyperthermia, mainly the heat exhaustion. Whenever there is a temperature elevated, this elevation is there, they increase oxygen consumption, increase metabolic rate, they lead to tachycardia and tachypnea. Tachypnea means rapid breathing. Then when we move to the above 42 degrees, that is near 108 Fahrenheit, then the oxidative phosphorylation is become uncoupled, and a variety of the enzymes cease to function. Hepatocytes, vascular endothelium damage, and the neurological tissues are the most sensitive to the effect, but all organs may be involved. As a result, these patients are at risk of multi-system failure. Then heat exhaustion is of two types, as I have told you earlier. It may be due to the volume depletion or it may be due to the salt depletion. Water depletion, that is the person is working in a hot and humid environment and is not drinking enough water, then simply the water depletion will be there as hypovolemia, and it can be replenished, it can be full. If you drink enough water, you can you can save yourself from the heat exhaustion. And this also some people say the voluntary dehydration, that is you are not going to drink water voluntarily, that is you can't provide water, is not provided to you, and it's very easy to treat this just drinking your plain water. Then we move to the other type, then the salt depletion. Whenever you cannot replenish, salt is lost in your through your sweat glands, and you cannot replenish it, or you have to drink some saltish water, that is plain water containing some salt, then you can easily avoid this salt depletion. That is the other type of the heat exhaustion. And there are different type of the symptoms are there, the weakness, fatigue, headache, mainly from the frontal headache, and then impaired judgment, that you are usually confused, and vertigo means chakarana, nausea, vomiting, and the muscle cramps, orthostatic dizziness, and syncope, that when you are going to change your posture from a sitting to the standing posture, you feel dizzy and you may be you may become faint at that time. And in this heat exhaustion, the core temperature is only moderately elevated, usually less than 40 degrees, and the signs of severe CNS dysfunctions are not present. This is very important, because these two things, when the temperature is above 40 and the signs of neurological problems are there, we move to the next topic, that is the heat stroke. Here in the heat exhaustion, the core temperature is usually moderate, that is less than 40, and CNS symptoms are not there. The central nervous system is usually not involved in this case. While when we see in the heat stroke is quite different from these things. In a heat stroke, mainly the body temperature rises, which fails the homeostatic thermoregulatory mechanisms. The failure results in elevation of body temperature extreme levels, greater than 40.5 degrees centigrade, more than 105, and this will lead to the multi-system tissue damage, mainly the renal failure, the oligouria, and the kidney damage is there, or the CNS is involved, where your neurons are going to be damaged at that time. This core body temperature is more than 40.5 degrees centigrade, 40.5 degrees centigrade, above 105 Fahrenheit, and this is associated with the central nervous system dysfunction. in the setting of large environmental heat load and cannot be dissipated. That means when we are working in a heated environment and you are unable to do the heat loss, and this which actually occurs in hot and humid environment. That means when the water vapors are more in your surrounding environment, you cannot dissipate heat properly. That evaporation is not there. That means heat is stored in your body and your body temperature begins to rise. And when it happens, it may lead to the acute respiratory distress syndrome. It may lead to the disseminated intravascular coagulation. It may lead to the renal or hepatic failure. It may lead to hypoglycemia, rhabdomyolysis, that is muscle damage, seizure, mean fits. All these things can happen due to the high body temperature, and this is mainly due to when you are unable to lose the heat due to the hot and humid environment. Then the resultant damage to tissue depends upon the body temperature, exposure time, workload, tissue perfusion, and these are multiple individual factors, your health, your age, timing, these all things are involved. Mainly the main stress is on the neurological dysfunction is a hallmark of the heat stroke, and cerebral edema is very common. Other pathological changes include the fatigue in the wall, so the third and the fourth ventricle, then there's cerebellar Purkinje cell damage, and hypothalamus, and the predominant side of central thermoregulatory control is usually spared. It is usually not damaged. It's not damaged. But when the death is there, all these things lead to the death. We will see later on what's happening there. Actually, first of all, what is the pathophysiology? Failure of the actually what happens? Your skin, the vessels, cutaneous vessels which are supplying the skin, they are responsible to transmit the heated blood to the skin, and from here it will be shifted to the environment. And when you are unable to provide the heated blood to the skin, and or the skin is unable to evaporate it into the environment, then it will lead to the storage of the heat in your body, and this will produce raised intracranial pressure, and this what will happen along with there will be reduction in the mean arterial pressure. This will lead to the compensatory splenic vasoconstriction. This will conspire to produce a fall in the cerebral blood flow, and this results in the major CNS dysfunction, which is a characteristic of the heat stroke. That means first of all, blood flow to the skin is not there, skin cannot transfer it to the environment. Then there is heat storage is more and more heat is stored in your body. This will lead to the raised intracranial pressure along with a drop in the mean arterial pressure. Then there is splenic vasoconstriction, and ultimately there will fall to the cerebral blood flow and leading to the major CNS dysfunction, which is a characteristic of the heat stroke. Then how you are going to diagnose it, the heat stroke? There are different ways, but simply the exposure when the history of exposure to the heat stress, endogenous, exogenous heat, then the severe CNS dysfunction signs of when your CNS is not functioning properly, the patient may feel or may go into the coma. It may feel seizure, that means fits, a delirium, that is confused personality. The patient is quite confused, you don't know where he is, where she is. Then the core temperature usually be above 105 degrees Fahrenheit, but it may be lower. Dry hot skin, but sweating may persist. Marked elevation of the hepatic transaminases. Actually, this hepatic SGPT, hepatic transaminases, you have seen the biochemistry SGPT and SGOT. They are 10,000. They are increased in very large number in the heat stroke. And this is an indication for the liver damage actually. And the different organs damaged, for example, your renal system is going to be damaged, the muscles are going to be damaged, and when the renal system is not there, that means your urine volume will be reduced, and it will become scanty, brownish, turbid fluid resembling the machine oil. And there will the muscle damage leading to rhabdomyolysis, the acute renal failure. All these things are seen in patients with the classical heat stroke. CHS means classical heat stroke, and more common the patient with the exertional heat stroke. There are two different types of the heat stroke. One is known as the classical heat stroke, and other is known as the exertional heat stroke. Then in the kidney you will see there is when the damage in your kidney, that will lead to the proteinuria, and granular casts are there, the RBCs are present, and there is acute renal failure, which is known as acute oligouric failure. Oligouric means less or very very less amount of urine. Normal rate of urine production is not there. Then your GFR is reduced. All these things are leading to the kidney damage. Then the multiple CNS problems are there, delirium, coma, convulsions, all these things are there. Here you have seen the word the bizarre behavior. All the obsessional hallucinations. Hallucination, that means someone is saying that someone is calling me, actually that person is not there. So I am looking, some person is there, that person is not actually there. And then the decerebrated rigidity and all these things, ocular crisis, cerebral dysfunctions, all these things may be present. Although this is not hard and fast rule, there's all the symptoms should be there, but some of them may be there and some one may not be there. But convulsions is very common. Fits have convulsions very common, and approximately 75% of the patients they have to face the convulsions. Then the circulatory failure is there, serious problems or multiple problems are there. Hyperdynamic cardiovascular system is damaged. Low peripheral vascular resistance, that means blood is going to pool in your peripherals and your venous return is less, and this will lead to the actually when this will lead to the circulatory failure. Actually we are not have to go into all these details, but you must know that during heat stroke mainly three systems are failed. There is your CNS, CVS, and the kidney. These three are the most commonly affected systems of your heat stroke during the heat stroke. Then the metabolism and hypoglycemia is very common. Hypoglycemia, remember, hypoglycemia is very common. All these, then it may be the pancreatitis. The rest of the things you must not remember. You must remember the hypoglycemia may be the symptom of the your heat stroke. Then hyperthermia will lead to the hemorrhage. That is the bleeding tendency is there. Why there is bleeding tendency? Due to the hepatic damage, due to the clotting factor activation, due to fibrinolysis, endothelial damage, megakaryocyte damage, thrombocytopenia, thrombolysis. All these things lead to the fibrinolysin powder. Fibrinolysin powders are increased, which are actually anticoagulants leading to the hemorrhage. So hyperthermia may lead to the hemorrhage. You must know the only these two words. The hyperthermia lead to the hemorrhage. And here is the pathophysiology between hyperthermia and the hemorrhage. Then diagnosis, definitely oral therapy. You can diagnose it very easily through your thermometer, and then you have to you can put the thermometer orally or the rectally. Anywhere you are feel easily, you may, if patient is unconscious, you may place in different areas. But thermometer types are there, infrared, pulmonary artery, all these things are there. But basically very important, when you feel the more temperature to the oral or rectal, then you can easily diagnose the patient with a heat stroke, because the patient is usually confused and having the fits, and you have to manage it just by cooling, just by replacement of the fluid and the electrolyte balance. You have to give the electrolyte to the patient according to the electrolyte analysis, and you have to replace the volume by giving the plain water or through the IV solutions, and keeping the patient in a cool environment. You can manage it easily. This is all about the heat stroke. You have to see the difference between the heat stroke and the heat exhaustion. Then we have seen some things which are concerned with the cooling, that is when your temperature become less than the normal, that is the cooling illnesses. Here the cooling illnesses, and which is known as hypothermia. When the body temperature is below 35, we label it as hypothermia. What are the different types of hypothermia? It may be the mild, between 35 32, it may be the moderate between 32 and the 30, and it may be the severe. Below 30 it is very severe. Then it may be a localized cold injuries, for example freezing, frost nip, frostbite, non-freezing injuries like trench foot or the cold immersion foot. These are the different names you must know. That these are different names, how they are going to occur. Pallor, numbness, frost nips, but you don't know these things. You must not know that each thing you have to memorize. Just you should know the knowledge of what are the different names of the cooling illnesses and what is the main temperature where it is going to start when it is below 30. Here are the different pictures of the frostbite. This is a different picture of the frostbite self-explanatory, and this is again picture concerned with the cooling illnesses. Here is again some pics concerned with the cooling problem, with the frostbite. So this was, dear student, this was all about the heat illnesses. Thank you very much being with me.